Hi guys, so welcome to Unit 4. This unit is going to be a little bit different now. We're going to be talking about disease and disease-producing organisms, which are often called pathogens. So let's get going. Alright, so first of all, if we're going to talk about disease, we should define it. And disease is going to be defined as an abnormality of the structure or function of a part or an organ of a system. Okay, so a disease can be anything from at a cellular level right up to an organ or organ system level. Okay, it may be felt or observed by others, so it could be something that's quite apparent to somebody else. It may have an unknown cause. We might not know what causes it, or we may know full well what causes it. And of course, the severity of the effects can be variable. We can have mild disease that people can live with their entire life, and we can have really severe disease that can cause severe health impairments or even death in a matter of weeks or months. So that's the definition of disease, so we can get this unit started. Now, disease is categorized in a number of different ways. So just think of the word disease as a really big term that encompasses a big whole slew of broad definitions. So we can talk about infection, which is caused by an invasion of pathogens, and a pathogen is any organism that can cause disease. Okay. We can also have degenerative diseases, so this would involve a disease where something in the body breaks down. For example, neurodegenerative, where we have a breakdown in the nervous system. And a disease such as Lou Gehrig's disease is an example of that, but there's many others. We can have nutritional diseases in the case of famine, for example, where the body doesn't receive key elements of nutrition for survival. We can also have diseases that prevent the body from absorbing key elements of nutrition that it needs. You can have metabolic disorders, so we can have instances where cellular metabolism is interfered with, and this can cause wide-ranging effects on the body. Immune disorders, where the immune system no longer works or is deficient, can make you susceptible to other diseases. We can have neoplasms, and the best example of a neoplasm is stuff like cancer. So it represents growths where we shouldn't have normal growth. And you can have psychiatric disorders, and this is diseases that's associated with the mental health. Now, the study of a disease's cause is called the etiology. So if you're looking about how a disease causes the symptoms and signs that it does, you're looking at the etiology of that disease. Now, there can be many factors that contribute to a disease in a person. Here's a list of a few here. We often call them predisposing causes. So this is stuff that you have that can contribute to the development of disease. And these things can include age. Certain diseases are onset as we get older. Gender, we have certain diseases that are specific to males or females. Hereditary, this one be the one that you say, oh, well, that particular disease runs in the family. It's caused by the genetics. Living conditions and habits, these can contribute to many diseases. Emotional disturbance, physical and chemical damage, could be anything from physical injuries to drug overuse. And also pre-existing illness. Sometimes having one illness can lead to other forms of disease. Now, the causes of disease are classified into two groups. Idiopathic diseases are caused from an obscure or an unknown cause. We're not quite sure where it came from. Now, iatrogenic disease is caused by medical examination or treatment. So, for example, if you went to the hospital to get stitches for a cut, and those stitches became infected, we would say that's an iatrogenic disease. Now, for us right now, epidemiology is a word you're going to hear in the news constantly, really. Since the COVID-19 pandemic, epidemiology has become probably one of the most important forms of study on the planet. And what epidemiology is the study of patterns and the causes, effects of health and disease conditions in defined populations. So what that means more specifically is we study how the disease behaves in people and around people and in populations. So in doing that, we'll collect an awful lot of statistics. Epidemiology is a study in health and definitely in numbers and patterns of numbers. So some of the things that we will look at is the incidence rate. So the incidence rate is a measure of the risk of developing some new condition within a specific period of time. So when we're looking at COVID, for example, and probably use COVID for a lot of these examples, we're looking at how often or what's the risk of being exposed or contracting COVID if we were in the classroom for a certain amount of time. This would be the type of thing that epidemiologists would look at. We'd also look at the prevalence rate, so the proportion of a population found to have a condition. So how common is this condition in the population? And for COVID, the only way we're really finding out is by doing testing, and Qatar is doing a great job at that, so we're pretty lucky in that respect. And then we also study mortality rate, and mortality rate looks at the number of deaths caused by a particular condition or disease within a population. Okay, epidemiologists also study disease categories, and I'm sure these three terms you've heard before: epidemic, endemic, and pandemic. So let's start off with an epidemic. Well, an epidemic is if a lot of people in a given region acquire a certain disease at a certain time. So epidemics can be stuff like a flu. You can have a flu epidemic that happens in a certain country, and flu season generally lasts in the fall of the year. So it would be in the northern hemisphere for us. It would be October to February or March. And that would be an epidemic. So a single condition or disease in the same place and the same time. Endemic is when we're talking about a disease that's found to a lesser extent. So maybe it's not as prevalent in the population, but it happens continuously over a particular region. Now, when I think of endemic, I often think of parasites. And for example, if you think about malaria, malaria is endemic to places that has a particular type of mosquito called the Anopheles mosquito, and it only exists there because that parasite needs that Anopheles mosquito to spread the disease. So, for example, it'd be very unlikely to catch malaria in the United States or Canada, but it'd be quite possible to catch it if you were to visit most places in Africa. Because it's endemic to Africa, but it's not endemic to other places in the world. So, and then finally, the last one is pandemic, and a pandemic is a really big deal. We're forced to live through a pandemic right now. A pandemic is when an epidemic spreads throughout an entire country or continent, or in the case of COVID-19, the entire planet. The only place that does not have COVID-19 right now that I know of is Antarctica. Everywhere else on the planet is affected by COVID-19. So it actually started out last January as an epidemic. It was a form of disease that many people in the region in China were getting. And then over time, by the time we reached March and April, it had gone from an epidemic to a pandemic. So if given enough time, you can see that these conditions, these disease categories can actually change. Now, a disease diagnosis, it's important for doctors in order to identify and treat a disease. You need to diagnose it, so you need to know exactly what it is you're looking for. So doctors make a diagnosis based on the symptoms and the signs of disease. Now, the symptoms it's the evidence of disease that's noticed by the patient. So when you go to the doctor and they ask you how you feel and you answer those questions, that's symptoms. He's getting information or she's getting information from you about the symptoms of that disease. Signs are evidence of that disease noted by the observer. So if you go into the doctor's office, he takes your temperature, he looks into your throat or into your ears, or uses a reflex hammer to test your knees. He's looking at or she's looking for evidence of a disease, and he can notice or she can notice that, and those are signs. So together, these signs and symptoms go together to form a syndrome. And a syndrome is a group of signs and symptoms that accompany a particular disease. So if you had chickenpox, for example, you would feel the symptoms would be itchy. You would probably feel hot. You'd have a fever, and you'd have little red bumps and a rash all over you. The doctor would also see the little red bumps and stuff like that, and then that together, those signs and symptoms would make up the syndrome that surrounds chickenpox, which is a type of herpes virus. Now we can classify diseases based on how long or how they affect the patient. So we can have an acute disease, and this is one that happens really quick. It comes on really, really fast. So this would be like a flu or a cold. You can have a chronic disease, and this is things that would happen over a very long period of time, like high blood pressure, for example, or heart disease, where it can take a long time for the disease to build up. And then you can also have another category called subacute, and this is when the disease falls somewhere between acute and a chronic case. The prognosis is what we call the outcome of disease. So if you get diagnosed with a disease, the doctor will often give you a prognosis. These are the things that can happen. We should be, for example, we should be able to cure this in 6 to 8 months, or this is going to be a very serious disease and it may take a long time to cure, so on. So the prognosis is what's going to happen in the future, the possible outcome. Once a disease is diagnosed, it's identified, then we switch to treatments. And basically, we fall on traditional medicine when we're thinking about treatment. So we first will start off with drugs and medication, and we can go to stuff like surgeries. We can also have other therapies like physical therapy, occupational, respiratory, and nutritional therapy. We also offer counseling and support groups. This can help people with dealing with the mental side of diseases. And there's also other many methods that exist in order to treat disease. Some of these alternative things that we can look at are naturopathy, so the concept of healing through a healthy lifestyle or returning to nature. A chiropractic, which is the field of manipulating musculoskeletal tissue in order to correct a disorder. So if you often see people on their back, they look like they're getting a very rough massage. That's an example of chiropractic. Acupuncture, so this is a method based out of China, where we put pins into the tissue in order to relieve pain and pressure. People can also refer or receive biofeedback treatment. So this is where we practice monitoring and controlling involuntary responses via electronic devices. So we could hook you up to a device that monitors these biofeedback rhythms, and then we can manipulate those to hopefully make somebody feel better. Then, of course, there's herbal medicine. So instead of using modern drugs, we look for stuff that occurs in nature. So herbs, potions, and so forth. Other people turn to massage, yoga, meditation. All of these things are possible helps or treatments when we're talking about different diseases and different forms of disease. Recently, one of the things that we've focused on is prevention. So the idea of keeping people healthy as long as we can so that we don't develop disease. So what we focus on now is like maintaining health. So keeping a healthy diet, exercising, stopping really bad habits such as smoking and drinking alcohol, controlling your weight so your weight doesn't get too high, which can result in a whole bunch of different types of stress on the body and lead to diseases, and generally living in a world or your personal life where you reduce the amount of stress that you have as much as possible. Stress can make you susceptible to many types of disease.